Our first presentation is titled Electronic Medical Records for Trans People, and it's being delivered by Jahu Chen. Jahu, who uses pronouns they, them, is a master's student at Karolinska Institution. She's currently working at the Life Ease Health Company, aiming to train more gender-friendly psychological counselors in China by introducing various psychotherapy courses. As an activist for human rights and LGBT people's rights, Jahu has actively joined minority community activities in both Chengdu, China, and Stockholm, in Stockholm, Sweden. Her passions include LGBT mental health, equality in electronic medical records, and the development of AI-based novel psychotherapies. This presentation is about a qualitative study on the overview of documenting sex and gender information in electronic health records from the health professionals' perspectives. From the semi-structured interviews with Swedish medical staff, a lot of aspects of the present situation reveal the problem of hegemonic heterosexuality lying deep in the medical system. Please welcome to the stage, Jahu.
Thank you. Hello everyone. So nice to see you today. I'm Jahu Chen. I go by them, and I recognize myself as a non-binary people. And I always believe that gender identity is very important to me. My ideal life is to live in the gender identity I recognized, with this information recorded in my electronic medical records. In this way, the healthcare professionals can better understand me and respect me during the medical constellations. That is part of the reason that I conducted this study. Also, there is a need for an open discussion about trans health that focuses on not only the access to gender-affirming care, but to overall care and good health processes. This study in total was a multinational study, including EU countries, Sweden, Germany, and also China and the US. But today I'm going to mainly focus on the situation in Sweden. But still there might be some code coming from another country involved in the presentation. Before I start, I have one more statement I want to say. I come from China, and I have been staying in Sweden for 2.5 years. During this time, I keep learning and getting more used to using English language system to describe gender identity, sexual orientation, and other terminology, to show my respect to people. But if there is something inaccurate in my presentation, please let me know. Maybe after the presentation, and I will definitely learn from you. Yeah. Let's start. First of all, this study views gender using a gender fluidity model, which describes gender as an axis from the femininity side to the masculinity side, rather than in a conventional gender binary way. And I briefly concluded the Sweden journey in advancing gender cognition laws. Sweden has long been at the forefront of transgender rights. The Gender Recognition Act of 1972 was a groundbreaking step, allowing juridical gender recognition and access to gender-affirming surgeries. Significant advancements have been achieved over the past few decades through litigation and activism. For example, in 2017, sterilization requirement for gender-affirming care was abolished. A major reform came in April this year when the Riksdag approved new gender laws set to take effect in next year, July the 1st. Maybe some of you already know. This include lower the minimum age for legal gender changes to 16 years old, while requiring a medical statement on the performance of one's gender identity. But still, a lot of things haven't been changed yet, such as the gendered personal identification number. In the Swedish personal number, the last 4 digits, one of them is symbolized the biological sex. These put trans people in a particularly vulnerable position. vis-a-vis the state due to the troubles of not fitting into the administrative system. This is the administrative system that distributes life changes and produce vulnerability so that those who are the most vulnerable in the society also are the ones at the highest risk of such state violence. And let's come to the Swedish healthcare system. The healthcare system in Sweden is an universal and public-funded service managed by 21 regions and 290 municipalities, with regional variation in its financing and organization. Besides that, the overall policy and high-level oversight are the responsibility of the National Ministry of Health and Social Affairs. A notable feature of Swedish healthcare system is integration of electronic medical records, and I will use the abbreviation EHR called in the later presentation. These centralized digital records enable seamless communication among the healthcare providers, improving patient care coordination and reducing medical errors. Simply logging in through the personal number at 1177, patients can get access to their medical record through secure online portals, empowering them to participate actively in their care. In the electronic medical records, gender-related data fields are often found in different sections. For example, the demographic information part or the past medical history. And also, this information might be present in various formats, including free text or categories. A lot of organizations, such as the World Professional Association for Transgender Health, WPATH, you might heard about it, have already published guidelines for claiming to implement gender identity and sexual orientation documentation in all certificated EHRs for the improvement of LGBTQ people healthcare. But challenges from previous study were still existing in the lack of accurately defined and inclusive sex and gender concept, terminology, and code in the medical system. The right pictures is the screenshot I've took from the Socialstyrelsen website. Now, the new version of the International Classification Diseases, ICD-11, has not been used in Sweden. So there might be old names for trans and non-binary people who want to seek hormone or other things, which may be not so friendly to them. And this page is the methodology of my study, which is a qualitative research with exploratory design. And here is the semantic analysis process. And the study was strictly followed the ethical reviews of European General Data Protection Regulation. And finally, after conducting all the semi-structured interviews, our research group extracted 6 themes and 14 sub-themes. And I will talk about them orderly. The first theme is gender issue in medicine. I asked the participant the question that, do you think gender is an important issue in the medical field? Why and why not? The majority of healthcare professionals' answer was yes, but they said the reason to think from the angle of biological sex, including autonomy, physiology of the body, laboratory tests, etc. In terms of gender identity, there are some thought-provoking responses. The most representative statement from Swedish healthcare professionals is that most healthcare is very structured, male or female, and we've learned from our patient that it's very hard to have that discussion. It's hard to get people to understand in healthcare when all they see is their biological sex. But very interestingly, there is an obvious conflicting assumption among medical professionals, especially those who are practice in the psychiatry and those who are not practice in psychiatry. When I interviewed with healthcare professionals, not from the psychiatry department, They thought that gender identity stands for one's psychological status, and it might be more important in the psychiatry department. However, when I interviewed a psychiatrist, and the person said that, here is the quote, you can see that. Gender identity is okay in psychiatry, but it's an important part of being respectful to people. And the second theme is that gender-related language system. Most interviewees agreed that it is beneficial to record gender identity data in the medical records. Majority Swedish healthcare professionals recorded that they had poor trained professional medical education about sex and gender, and also about transgender people's healthcare. But young generation of Swedish medical workers said that they have that discussion about gender identity in their high school or even earlier, but not during their medical professional career. So most of them got to know about gender minority people from their life, including social media, friends, novel, and even movies. Few practitioners disagreed and thought it might be unnecessary and becoming an intrusion of privacy. Here is the code. I could imagine that the patient coming in for a headache doesn't want to explain his gender identity and sexual orientation each time. This behavior could perhaps feel like an unnecessary intrusion of privacy. Apart from that, the instability and variability of the gender identity data seems a challenging problem for the healthcare professionals. A German doctor said that, here is the code. In the medical system, if a person can choose gender, this kind of variability is actually an hindrance to doctor's judgment and to the doctor's treatment. However, when I interviewed a trans doctor who had said something, I totally agreed. Here is the quote, the last paragraph. People should add gender identity information and change their pronoun as well, just like changing their address and phone number. So it shouldn't be a big deal. The person just needs to say to the healthcare professionals, hey, I want to change it now, and that's it. We're all complex human beings. We must have medical record system that can adapt to that variability. And the third theme is the interaction between healthcare professionals and the patients. Majority Swedish healthcare professionals said that when they met trans and non-binary people, they deal with this situation very carefully and respectfully. They would follow people's willingness of using which gender identity and pronoun. However, some of the healthcare professionals confessed that they're a bit afraid and uncomfortable when asking people for their gender identity and pronoun, especially heterosexual healthcare professionals. So although they might want to know about their patients' this information in their heart. So sometimes they are also they are in a dilemma of whether asking or not. Also said by an American lesbian doctor, here is the quote, this paragraph. A lot of gender minority people might be equally in a dilemma. As a doctor, I even don't feel safe, not to mention my patients. There are so many the new generation G who haven't been seeing really horrible things that had happened to them, like being beaten up. So they might be more willing to disclose gender identity and sexual orientation data. So that's one of the issue. From the patient point of view, to understand how many people are not being counted because they're afraid to tell the truth. And the theme 4 is influence factor of society, politics, and cultural. These themes varies the most from country to country, including the extent of gender bias. For example, in my home country in China, there's no legislative guarantees for LGBTQ plus people, and this topic almost like a social taboo. and minority people are suffering from poor social acceptance. Although this situation is much better here in Sweden, this topic is also sensitive in the society, which might cause conflict between people. And the theme 5 is technical issue. I've divided this part into the benefit part and also the deficiency part. In present electronic medical record system, the gender-related data is directly retrieved from the ID card with simple medical process and consistency. Also, there are various versatile formats that can input gender-related data, including categories, free text in the patient history, banners and comments, etc. In terms of deficiencies, low operability and compatibility of the system becomes a major problem. Most of the EHR system, they only have 2 choices of genders in the demographic data part, and it's very hard to change them. Also, in some system, the binary gender links to different medical history catalogs, which causes a lot of troubles and repetitions in the clinical practice. An American doctor told me an example of that, and the code is here. For my male pregnant patients, the EHR didn't have a pregnancy episode for a man, and I had to turn it under woman, and the name came up as a person's unused name, the name before they transitioned. And the 6th theme is ethical and legal considerations. I asked every participant about what is privacy, and they surprisingly gave me very different answers. One of the Swedish healthcare professionals said that we have to know what organs you have, like reproductive organs, so I guess that's part of the privacy in a healthcare settings. The common ground for most healthcare professionals is that they are aware of the risks for information leaking. One participant said that there is a high risk of things being misused or coming in the wrong places, so you have to think about what you document. You should document what is important, but you shouldn't over-document things. That can be irrelevant, so you should always think about documenting relevant things for what you are working with and what you need. And here is the reference of my research. And yeah, that's all my presentation. Thank you for listening. If you, I would like to kindly ask for scanning the QR code and give us the opinion that you believe and what the picture in your mind think the health electronic medical record could be. And the imagination is very important to us to build our future. You might feel a little bit sad or frustrated after listening, but clearly you see that where we are now and where we are heading and how far we are from our goal. What we need are just time and continuous effort. That's all.